Taoiseach, the situation in our accident and emergency departments is chaotic and now out of control. I think all of us in this House will have been shocked at the contents of a letter written by an emergency consultant in Tallaght Hospital to his Chief Executive Officer, which was copied to the Minister for Health and which I mentioned yesterday to you. And it outlines how a couple in their 90s, married for 59 years, found themselves waiting for long periods in the emergency department. The man himself had advanced Parkinson's and was on a trolley on a conduit between the psychiatric rooms and some cubicles for over 29 hours. 29 hours, Taoiseach. And the consultant talks about 79 patients at 2211 in the department in total, with 19 admitted boarders. 2 of these unfortunate patients were in the department for greater than 2 days. In terms of the man with advanced Parkinson's, he says, "This man, like the others in non-designated patient conduits, have no privacy, no dignity, are subject to constant noise torture, constant light torture, resulting in major sleep deprivation, pressure effects causing pain, as lying for advanced periods on a trolley not designed for the same, as well as boarding conditions that constitute an infection control hazard." And he says that nobody of any age should be subjected to this inhumanity. And he goes on about gross governance failure, evidenced by 2 patients who were boarded and deemed to be requiring isolation. He talks about a patient festering for 2 days and 11 hours at the time of writing as an admitted boarder, and talks about a dedicated pressure-controlled isolation room that currently lies idle in the expanded new emergency department, along with 8 cubicles, again lying idle since June of this year. And then, chillingly, he writes at the end of the letter, "It's only a matter of time before we disclose our next crowding-related death at Tallaght Hospital while crowding is tolerated." And Taoiseach, the INMO have now balloted for industrial action, citing record numbers on trolleys in our hospital emergency departments. 80,000 in the last 10 months, an all-time high since Trolley Watch. 8,000 in the month of October alone. And the question I would put to you, Taoiseach, you decided to take personal charge of health 2 years ago. You announced to the House you were taking personal charge. This letter speaks to an absence of decency and dignity. The situation has got worse, Taoiseach, over the last 2 years. Can you explain to the House how it has got worse? And are you not ashamed of this damning indictment of your stewardship?
Please. Give the Minister.
First thing I want to say about this, Deputy Martin, is that I agree with the consultant. I agree with the consultant concerned that this is a shocking example of a dysfunctionality in the system. I agree with that. You don't need legislation to know that you should not have a 91-year-old on a trolley for these length of hours, and his wife. You don't need any legislation to understand that. Now, I'd like to know, now when that patient came into that hospital at 91 years of age and was put on that trolley and was there for 29 hours, as the consultant pointed out, who was the person responsible for leaving that person there? Now, I know that there are serious changes. There are serious changes being implemented in many of our hospitals. Serious changes. And some of these changes are being resisted, as they always have been resisted. But it's important to understand that from any sense of humanity, a 91-year-old man should not be on a trolley in the first place if it can be at all prevented, but certainly not for this, as pointed out by the consultant, the indignity and the lack of privacy and the noise and the light interference in his senior years. Now, emergency departmental overcrowding remains a serious challenge. We were told earlier on in the year that if you provided extra money for the fair deal to get this down from 15 weeks down to a more normal level, that this would end this particular problem. That was provided, and it's now 4 weeks, and it didn't deal with the problem as was envisaged. There's an extra 117 million allocated this year to free up hospital beds, to create additional beds, and to hire more staff. Now, I didn't hear the hospital manager or the bed manager in respect of Tallaght speak in respect of this particular instance, and I don't have all the details other than the letter that Deputy Martin has referred to from the consultant, with whose view I agree here. Obviously, the task force that the Minister has set up in respect of emergency departmental issues meets on a regular basis. There are more beds. Delayed discharges are reducing steadily since the start of the year. Beds in the community in Mount Carmel, for instance, have been opened. 300 additional beds in the hospitals are to open shortly, as already announced and money in place. There are a series of campaigns going on here to attract frontline staff. Since January of this year, there are 500 more nurses in the health service. Since September 2011, there are almost 300 additional consultants have been appointed, including 57 more this year. And the number of NCHDs employed has increased by over 250 since last year. Now, I'd say, Deputy Martin, this is a case that I just don't understand how it can be allowed to happen to a 91-year-old. And it's up to everybody in the health service to play their part and to accept their responsibility to work to ensure that the plan actually works. I mean, any of you, your own families of hospitals that you visit, surely somebody has to make a decision about the extent of medical priority to leave a 91-year-old on a trolley for 29 hours. So the facilities are being provided, the extra staff are being provided, the money is being provided, and it's still not making the impact that it should. And I'm quite sure that over the next number of weeks, you're going to get other cases that are quite shocking being brought to light.
Thank you.
And this is a challenge for everybody. Ministers provided the money through the budget, extra staff being appointed and being attracted, and you still get these kinds of cases. I'd like to hear the response from the hospital. I'm not passing the buck here, but the point is that anybody in an accident and emergency, if you have to make choices, you don't leave. You do not leave a 91-year-old on a trolley for 29 hours. I agree with this consultant in his views.
Taoiseach,
Maybe you should look to. Maybe you should sit down.
I will not, I think it's outrageous. You have 90-year-old people on trolleys. It's absolutely, and it's happening every single day.
Don't be putting on a show. Don't be putting on a show for the television. Don't be putting on a show for the television and resume your seat. Resume your seat. You didn't raise anything. The deputy will leave the chamber. Leave the chamber. The deputy will leave the chamber. Leave the chamber. I told you to leave the chamber. 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 When the deputy wants to be named, leave the chamber. This is leaders' questions, and no deputy is entitled to interfere in leaders' questions to make a show.
Taoiseach, last February, we were all shocked that a 100-year-old woman spent 24 hours on a trolley. And you said the same thing last February.
Yes.
And last January, Minister Varadkar produced his 25 priorities when he published a budget last January, reducing A&E waiting times for less than 9 hours, the people waiting longer than 9 hours for over a third. And you come in here today and you ask, you'd love to know why this is happening? After you saying 2 years ago you were going to take personal charge? After the Minister establishing a task force, the co-chairman of which says it hasn't made a dent on the problem. And then, Taoiseach, you say people are resisting change. That's an appalling assertion against the staff in our emergency departments. And if you listen to the staff, they're absolutely at the end of their tether in terms of the stress and strain in emergency departments. I saw on RT last Monday week a series on A&E, and the staff were saying it was appalling from their perspective to watch patients in such distressing conditions and under such stress and strain. It is not good enough, Taoiseach, for you to say that the staff are resisting change, or that people, by resisting change, are slowing down progress, or that you wonder out aloud
Sorry, Deputy,
as
would you please put your question?
You don't know what's happening.
Thank you.
It is your job. You must accept responsibility, Taoiseach, and the Minister must accept responsibility. It's not about saying the staff must accept responsibility. The staff are accepting it. It really is your job to accept it, Taoiseach, and you should be explaining to me
you put your
the
question,
first
please?
question I asked, which I didn't get an answer to. What was the first question I put to you? Why has the situation got worse in the last 2 years, Taoiseach? I'd like to know why, because if we could find that out, then you might have some chance, or people might believe you, that there's a prospect of you getting to grips with what is a chaotic.
Would you please resume your seat? Taoiseach.
In our emergency department.
Sorry, would you please... have you taken over the role of Taoiseach or something?
I listened to Deputy Martin on this on many occasions. You ask what has happened since then, why the situation is worse. I've already pointed out to you that the delayed discharges are reducing steadily since the start of the year, freeing up beds. Beds in the community, like for example Mount Carmel, have opened, and 300 more are due to open very shortly, as announced and money in place. Of course, Deputy Martin, with an ageing population and those of senior years increasing in number and living longer, thanks be to God, obviously people are required and have occasion to go to hospital on a very regular basis. So, given that statistic alone, you need further opportunity to treat people. But I want to make this perfectly clear. The people who work in the frontline situations in our hospitals, I've seen them work under stressful conditions, work under pressure at all times, and they do a marvellous job. But you get these cases on a pretty regular basis. We've had them in a number of other hospitals around the country recently. And they're pointed out, for whatever reason, some hospitals are not able to be as efficient as some others. Now, the Chief Executive of the HSE has visited 19 hospitals in the last number of weeks where the pressure in this kind of situation was more acute and more obvious than in other cases. I'm not saying that staff are resisting change. Change is always difficult to implement. But the government, in response to queries last February and March, put more money into the system to reduce the discharge for availability of the fair deal, and it went from 18 weeks down to 4. That was supposed to deal with the problem. It didn't deal with it. We now have an extra 300 beds coming on and extra money in the system. So if the facilities are there and the money are there, is this a management problem, or is it just exacerbated because of a situation that can apply in any locality where more people have to go to hospital? Yes. So you try to provide the resources and the facilities to deal with the problems. But in any lineup, in any accident and emergency unit, if the choice is to leave a 91-year-old on a trolley for 29 hours, I don't accept that should be the case, and it shouldn't be the case. And I agree with the consultant who wrote his letter and sent it in publicly.
Thank you.
Obviously, there's a clinical review in this particular case taking place in Tala Hospital in Cancola, and I'd like to hear from the person in charge as to the situation that actually applied in this case.